Hey, good afternoon. Good afternoon. How y'all doing? Everything's squeaky. I don't like that. Can do a couple of problems with y'all this afternoon, if that's okay. New people, old people, people. Yeah. Why is my camera looking like this? I don't like that. Wait a minute. There we go. How y'all doing? Happy Tuesday, Nurse Juicy McFat. Hey, Muriel. Y'all let me know if y'all can hear me on YouTube. I have my AirPod in. Hello, I just came in to do a couple of problems with you all. The live sessions that are officially scheduled have been halted for a second. Hey, Elantra. Good, good, good. Okay. And let's start off with some easy peasy lemon squeezies. And we'll work our way up into some harder things, okay? All right, let's do it. Wonderful, wonderful. I have a workbook coming out, Jeremy Morgan. It will probably be available in the upcoming weeks. It will be available in the upcoming weeks. So I'm trying to get production for the print copy because it'll be in PDF form and it'll be a spiral bound workbook so you can write your problems out in. So yeah, I'm excited. I am excited. So excited. All right. So if you don't know me, I'm Darcy. Let's start in. I help nursing students, pre-med, pharmacy, respiratory, all types of folks with dosage calculations. Okay. So we are going to do a couple of problems, starting out with the yes. Are you excited? I'm excited. I'm excited that you're excited because people have been asking me, and it's been in the works for a long time. And yeah. You start your program in January, it'll be ready before January, definitely, definitely. So just keep your eyes out. That makes me excited. I wanted it to be like me in book form. So it took a while and yeah. But definitely, he said, "Thank God." Yes, ain't he good? He is. All right. So I'm gonna start with some conversion problems. Y'all know I preach that you have to know your metric conversions in order to be successful at dosage calculations. Okay. So that's first and foremost. So in order to get the rest of the puzzle pieces together, you got to know the puzzle pieces and what they are. So this one is 1.5 grams equals how many micrograms? All right. So the first thing that we do after we read the question is we find the goal. So this is asking us to find micrograms. I can't get my webcam right. So I'm at my office because it's the end of the day. We've transported people. Mm, almost QDDJ. I can't say that name. You just started Farm to Sweet Miriam. That's awesome. How you liking it? All right. So we're looking for micrograms, right? Yeah, it's still not doing right. Hold on. Oh, well, you have to do the cutoff. So, all right, what are we looking for? So we know that we have to go from grams to micrograms. So let me put this out there first. We know that there's the gram, the milligram, and the microgram, and of course the kilogram. That's the big kahuna, right? So we know that all of these are separated by the factor of 1,000. Okay. So from here to here, is 1,000. So, well, going this way. So 1,000 grams is 1 kilogram. We know from here to here is 1,000. So 1,000 milligrams is 1 gram. Then from here to here is 1,000. So 1,000 micrograms is 1 milligram. So you see, there's a total of 6 zeros. Right, right. So you got to account for all of those zeros. Okay. So what we'll do is we will put our puzzle pieces together. And for some people, they want to know like a way to multiply, how I know how to divide, move the decimal this way, move the decimal that way. Dimensional analysis is not that type of trip. Okay, it's going to set your puzzle pieces up. So the only thing that you have to do is multiply and divide. Now, if you want tips and tricks on, I want to move it this way, and that way, then I got something for you too. But for the most part, dimensional is not that girl. Okay, it's that girl, but it's not that type of girl. All right. So my puzzle pieces are: I know I'm going from gram to microgram. So 1 gram is what? 1,000 milligrams. And then I know that 1 milligram is 1,000 micrograms. And then, of course, the problem gave me that we have 1.5 grams. Okay. So if I'm going from gram to microgram, I'm sorry. And we had a little dive on my phone. All right, we good? We good. Okay. No, we can't see now. Uh, I'm trying to use my YouTube features more so we can get used to it because we don't know the fate of TikTok, right? So I'll start off with what it is that I'm looking for. I need micrograms, so my puzzle piece has to have the microgram in it. Okay, so 1,000 micrograms is 1 milligram. So you see, if you start with your goal, everything else that comes behind it has to line up and cancel out. You cancel out your units by putting the same unit of measure on the top and on the bottom. Okay, so therefore, now we can put our milligrams, right? So I have this puzzle piece. 1,000 milligrams is 1 gram. Now you see my milligrams have crossed out. And the only thing that I'm left with now is 1.5 grams. Okay. So therefore, everything is gone now except for what we were looking for, which is the goal. So it's 1,000 times 1,000, which is a million, times 1.5. So it's going to be 1,500, comma 000 micrograms. So you gotta make sure you include all of your zeros. Um, I really want to know, how often do we really have to manually do drug conversions in the hospital? It depends on what type of nursing that you go into, your specialty. I know peds nurses usually do a lot of converting because you have to be careful with those little babies, right? I'm trying to see all of the other messages that I missed. Uh, okay. Mm, you just finished your farm class. I pray that you were successful. Got a 95 on my dosage first try. Got two wrong, and it wasn't a dosage question. So technically, on her, I'll take a tick. I will take a tick. Yes, congratulations. Okay. Hey, 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 G Good. I'm good. How are you? I'm also on my YouTube, y'all. So make sure, if you're not following me on YouTube, you're there so that we can continue to study. T Slay, I'm good. How are you? Period, Pooh. Haha, you're welcome. Starting nursing school in the spring, and I'm nursing ABT Farm. You're nervous about farm. Hey, Brenda, how you doing? Don't be nervous about farm. It's just drugs. Ah, I was hoping a machine could always do our drug math scores. No, I mean, it's normally done. It's some things that you might want to check, because everybody is human. okay? And you're the human that's giving the medicine and the human that'll be in court. So you want to know what you're doing, right? You're the expert. You want to be proficient. You want to be knowledgeable. You want to trust yourself and your skill sets, right? She missed 2 questions on her dosage exam. That wasn't dosage questions. Yes, Barbie, she said that she had I guess it was like, you know how like they mix farm and dosage together? And so the questions that she missed weren't like dosage calculations questions. So that's when she said technically she got a 100 on the dosage part. All right. We have to get a 90 and above or we get put out the quiz. See, and that's what I don't like. I don't like that. I don't like it. It produces so much anxiety, and people come on here and when we study one on one, and they're so afraid. But you don't have to be afraid. We're gonna do puzzle pieces, okay? No fear, no tears. We solve puzzle pieces here, okay? What is my opinion on DRAM and grains? Should we be worried about them? Different programs, some don't even use DRAMs or grains. You really don't see dram for real in the hospital. Last time I saw a dram was because of the type of bottles we used that in the pharmacy to put the medicine in. And grains are just milligrams. So 1 grain is 60 milligrams. What grain? I haven't seen grains in a while. And I travel. I've been in different types of hospitals. I haven't seen any medicine that was in grains, but you know. Still good to know because you never know where you might end up at. Some little backwoods, whole punk, podunk, whatever hospital, and you still got grains, okay? So then you'll know it. Um, I had a final on Thursday and I had like 5 final questions. I was breezing through them. Yes, love it. You're welcome. You're doing us justice out here with these practice questions sessions. Thank you. I'm glad you like them. We touch on the grains, but not the drams. Yeah. That's why I'm like, why is my school enforcing them? Yeah, yeah. So I mean, it's just it's another conversion for unfortunately. Mm, let's see, but why did they put questions on of farm on her dosage? Well, when I was in school, like we didn't have like a like dosage calculations class. It was part of the pharmacology class. So they would ask us pharmacology questions too, but we will also have that mandatory questions, well, dosage exam that you have to pass. So that's probably why. I don't know. Who knows why these people in nursing school do what they do? We just gonna put these puzzle pieces together and walk away in victory. Hallelujah. All right, let's do this. 6.5 cups is how many mLs? So our goal is milliliters, right? So now we need to get our puzzle pieces. So we've got 6.5 cups, and then we know that 1 cup is what, 8 ounces? And then I know that 1 ounce is 30 milliliters. So you see, I go from unit to unit, seeing if there is a common conversion that I need. And I know that all other units have to cross out except for milliliters. So I've got to have something to cross out with my ounces, and then I've got to have something to cross out with my cups, and it has to be the same units, okay? All right. We had 2 days. They taught dosage and they added 2 additional questions. My Lord. Ah, all right. We're gonna get through it, y'all. I promise you, we're gonna get through it. So I'll start with what I'm looking for. So that's this puzzle piece. 30 milliliters is 1 ounce. And then I have 8 ounces, which is 1 cup. And I'll cross my cup out. And then I have 6.5 cups. And you see, I just go from unit to unit, making sure another unit that's the same unit of measure is there to cross out and cancel until I get what's left. That's all dimensional analysis is. Hardly any math until you get to the end, which you have to multiply and divide. So if you're not good at math and you're kind of frustrated with dimensional analysis, give it another try because I hated dimensional analysis when I was in school. But now I would not suggest any other method because you can do it the same way. You don't need a whole bunch of math skills and it works for almost all of your questions. It's a handful. And I'm working on a playlist of the abnormals, like your BSA, which is a formula, your PEDS, say your peds fluid volume maintenance. because you have to have another formula for that, and like 2 feet in dilution because it's different. But for all of your other problems, you can pretty much do dimensional analysis and get away with it, no matter what it's asking you for. You'll be able to find it using your goal and your puzzle pieces. Yep, yep, yep. All right. Y'all want to do some more? I keep trying not to speed up the conversions. I went straight. You could do that, Tiffany. You could do that. It will still work out just as long as it crosses out. So if only you knew. Okay, see, I was about to go in the song. I have to restrain myself. If you knew that 1 cup was 240 milliliters, it still would have worked out. So if you had 240 mLs is 1 cup, and then you had 6.5 cups, you see the cups still cross out and you're still left with that. So 240 times 6.5, it's the same answer. So that's what I'm saying. You can't mess it up. If you have the correct conversions, if you know your conversions, you got the equation set up to how it needs to be. So the numbers that's on the top can multiply, and numbers on the bottom can multiply, you divide them, then yeah. My YouTube name is the same handle on here as with all my social media. It's a blessed RN. A blessed RN. I'm gonna move my camera real quick, y'all. Mm, let's see about that. It'll work, but it's better than being cut off, okay? All right, what I'm doing now. What am I doing? Okay. All right. So you had a baby. The baby was 14 pounds and 5 ounces. Well, we're gonna say that's after a couple of months because if they come out 14 pounds, 5 ounces, then my God, help us, Lord. Uh We need to know how many kgs because usually when you have your problems in pediatrics, you have to use kilograms, right? So we can't go directly from ounces to kgs. We have to go pounds to kg because, yeah, I know, right? That's a big old baby. I start nursing school in February. Is doses calc hard to learn? No, well, you can't ask me. You can't ask me. I actually like it. I think it's fun. I think that if it's taught right, it's not hard. If you do it my way with the puzzle piece method, using dimensional analysis, it's not bad at all. Um, but that's in my professional opinion. Okay. So what we'll do is we will change this to pounds. So then we can combine like terms. Okay. And then we'll go from pounds to kgs. All right. So our goal is pounds. So we're converting 5 ounces, and we know that 1 pound equals 16 ounces. There those conversions go again. I have a workbook coming out. I have a workbook coming out. I have a workbook coming out. It is in the final stages. Yes, 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 yes. I can let the cat out the bag now. I've been trying to hold it in. Yes, it is almost finished, y'all. Thank you. Thank you for the support. I appreciate that. All right. So, what are we doing? We're starting with pounds. Pounds is what you're looking for, right? So, we got 1 pound is 16 ounces. And then we have our 5 ounces that'll cross out. Anything that's just by itself doesn't necessarily need a partner. Okay. So, if you have like the ounces right here and it's just ounces, 5 ounces doesn't equal a day. You know what I'm saying? Because a lot of people try to pair something to make it fit something. If it's just by itself, put it over one. Anything divided by one is itself. Anything multiplied by one is what? Itself. So it doesn't change it mathematically. And that one shows you that boop is at the top. I'm so tickled. Oh my gosh. Y'all don't do that. Y'all gonna make me blush. Oh man. More details soon. More details soon. And y'all make sure you follow me on my YouTube so that we can still stay connected after this so-called ban happens. I'm tired of seeing like if the ban happens, it's not gonna happen, like what's gonna go on. Hey, Rena. I know I told you to put the notifications on so we can stay connected. Okay. So now we'll do 5 divided by 16. I'm sitting here in my office at the end of the day. Y'all see, this is my business. We take patients to doctor's appointments, to dialysis, surgery, all kind of stuff. So yeah. So this is what we have in pounds, right? And so then we need to add our like terms. So our new pounds will be 14.3125, right? So now we can take our pounds and then convert them to kilograms, okay? So kgs is our goal. So we'll do, what will we do? 14, well, 1 kg, of course, is 2.2 pounds. If you don't learn nothing else, please learn that 1 kg is 2.2 pounds because you'll need it a lot. And then we have 14.3125 pounds is our converted weight. Yeah, you'll always see that one, right? So 1 kg is 2.2 pounds times 14.3125 pounds. And we'll cross out our pounds. So you see, we doing this the same way. We always start with what we're looking for. So that's what we'll get because that's what the answer, I mean, the problem wants in the answer. So 4.3125 divided by 2.2, 6.5 kgs. And that's how you do that. That's how you do it. Okay. So yes, you can use dimensional analysis from even the easiest. Ooh, look, it's a fraction. Y'all like fraction? Thank you. Push a P. Push a P. Hmm. All right. So fractions, even whole. Okay. They're not even whole. So what we'll do is we'll turn this from a mixed fraction to an improper fraction. So with when we change the mixed fraction to improper fraction, you multiply the denominator by the whole number. So the big old number times the bottom number, and then we'll add the top number, all while keeping it over the same denominator, which is the bottom number. Okay. So we'll do 5 times 3, which is 15. And then we'll add the top, which is 17, and it'll go over 3. Exactly, Mercedes. All right. So our new cups amount in fraction form is 17, 17 thirds cups equals how many mLs? So our goal is ml. So we know that we have 17 over 3 cups. We have, so who was that earlier? Yeah, Fran, put it in the chat. I called you Fran like we know each other. I'm sorry. Yes, Francesca. What okay. So we have 1 cup equals 240 milliliters. My friend from earlier wanted to do the short way. So I showed you the long way. So I can show you the short way too, okay? Alrighty. So we'll do 240 mLs because that's what we're looking for, okay? 240 is 1 cup. Boom, boom. And then we have 17 on the top and 3 on the bottom. That's how you do it with the fractions. So we just multiply 240 times 17 divided by 3. So 240 times 17 divided by 3. So I got 1,360 milliliters. I don't. It's this close. It's this close. Demi Kayla. I promise you, I'm gonna be dropping hints soon and very soon. I promise. Just keep looking out. Just keep looking out. I can tell you now it's got over 300 problems in there. It's got some problems in there. I love the short way, but we got the same thing. Yeah, I'm glad you're here too. Simply gorgeous. Yeah. Yeah. Where did 240 come from? Hearts. So 1 cup equals 8 ounces. And then, of course, since 1 ounce is 30 mLs, that also equals 240. So you could say that 1 cup equals 8 ounces, or you can say that 1 cup equals 240. So if you can't remember 240, but you know 8 ounces, then you still good money. The healthcare provider prescribes amoxicillin 1.5 grams PO daily in equally divided doses to be administered every 8 hours. The medicine is available in a bottle. Label amoxicillin suspension 200 milligrams per 5 milliliters. Okay, so what's the question? What is it going to ask? Because I know it's coming. How many mLs should the nurse administer every 8 hours? Okay, so every 8 hours, it's in the chat, Rena. It's in the chat. It was a request by friend. Oh, okay. So basically, okay, so I'll just write out the details, okay? So we have ordered 1.5 grams daily, okay? And in equally divided doses every 8 hours. So you give, so equally divided doses every 8 hours. And then you have 200 milligrams per 5 ml. And it's asking us how many mLs would we give basically for 1 dose, because you give 1 dose every 8 hours. So we're looking for how many milliliters per dose. Okay. Us girlies need you because these instructors don't be instructing. Uh, I heard that. I heard that once or twice before. So yes, come on in. All who are heavy, heavy burden by dosage calculations, we gonna put these puzzle pieces together, okay? All right. So look, let me tell you something. Let's break this down. This is the amount for the whole day. You can't give it all at one time. That's why it says it has to be given in equally divided doses every 8 hours. So 8 hours comes, you give a dose, 8 hours comes, you give a dose, 8 hours comes, you give a dose. Okay. In order to find, he has no more hemoglobin. Bruh, stop. Please, 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 please. Hold on. He hemoglobined. Every time he went to the bathroom, he hemoglobin. I want not to laugh so bad because she was so serious. Her heart was in the right place, but the hemoglobin was not. Okay, so back to the question at hand. If you have 24 hours in a day, okay, 24 hours in a day, and you give a dose every 8 hours, this is going to tell you that we have 3 doses in the day. And see, this wants to start cutting up and writing my math out for me, and I don't want it to do that. Okay. So, this is what we're going to do. So, our goal is milliliter per dose. So, we have 1.5 grams a day. In one day, we have 3 doses. And then what's available is 200 milligrams per 5 ml. Okay. So I'm going to scoot this up a little bit. So we always start with what it is that we're looking for. Okay. So I'm gonna start with my milliliters. So 5 milliliters is 200 milligrams. Now, my other puzzle piece has grams in it. I can't put a gram on top of a milligram, okay? So therefore, I have to do 1,000 milligrams is 1 gram. That's our conversion, okay? Now I can put this bad boy up there and cancel it out, okay? And you just go from unit to unit. If you're stuck on how to set it up, you don't know what comes first, what comes next, just go from unit to unit. If this is not part of this, because we already started with this, so the only thing that we need is this, right? So if it's not a part of the goal, it's got to go. So you have to put a puzzle piece to cancel it out on the top, and it has to match. If you don't have a puzzle piece with that unit, you can always put in a conversion, okay? So therefore, what's next? We got day at the bottom. So this last piece has day in it. So one day has three doses, okay? So day crosses out, and now you have milliliter per dose, which is the goal. So then we'll do 5 times 1,000 times 1.5 divided by 200 divided by 3. And I got 12.5 milliliters per dose. Thank you, Yvette, for the ice cream. I'm lactose intolerant though. He has no more hemoglobin. Oh, so divide it all by 3. Yeah, you could do that. Wait, it's zero point 0.5. It's zero point 0.5? Hold on. Are you changing the question? Or did I change the question? No. Okay. Um, I converted 200 milligrams. Well, I convert 200 to grams to simplify it. Why you gonna change the medicine? The medicine is the medicine. If you're gonna change anything, change the order. But you don't have to change anything, honestly. If you put the conversions inside the equation, it'll take care of it for you. So you don't have to do anything setting up the equation. The math is going to math. It'll be all set up. You'll see all of your units cross out. So therefore, you really can't make a mistake because you see how everything that's on the bottom crosses out except for what it is that you're looking for. So even if you try to put in a puzzle piece that does not belong, it won't fit. So that's why I call it a puzzle, just like in real life. If you try to put a puzzle piece in and you're trying to force it in there, it's not going to fit. It won't fit in here. It won't make sense, and you're like, "Okay, I need to do something different." Okay. The question was in the comment. So the comment section. So I just wrote down the pertinent information. So the order and what's available is that. Uh, you have to convert the order. Let's see. The healthcare provider prescribes a low dose heparin protocol. 12, look at you, friend. You was like, oh, here we go. Uh, 12 unit per kilogram per hour. Heparin contains 25,000 units and 250 mLs of DW. Okay. Um, the heparin. So the first thing we need to do is conversions. Hold on. It's going too fast. I'm studying for my HESI exit tomorrow. Oh shoot, get it. Okay, so what is the heparin question asking? Hmm, Excuse me, y'all. So good. Thank you, Kiki. I'm glad you liking it. I believe that dose calculation should not be hard. The order is 1.5. Yep. Chat GPT said it was 5. Chat GPT be lying, y'all. Chat GPT is not the gospel, okay? Chat GPT will get you messed up if you heavily rely on Chat GPT. I did it on purpose to see will it mess up some stuff. And guess what? It did. It had me sitting over here. I was like, I know I'm wrong. Right. Yeah, that's wrong. And it could be how you worded it too. Okay. Yeah, I was about to say, and there's nothing that's 100. Okay, this is the only way I can do it. Another way confuses me. Chat GBT be messing up. I'm telling you, Chat GBT. Chat GPT is all right in some of its ways, but sometimes it's not the business. It could be wrong. Ooh, let's do this. Because I don't see the rest of your question about the heparin. Got some math questions wrong. Okay, I failed my first dosage calculus this semester. Oh, it's okay. Failure is not final, and delay is not denied. And see, you were so close. What did you have to get? You got an 85 out of 100. That's still good, though. This type of calculation got me in your final. Okay. You had to get a 90. Dang, so close. So close. All right, let's do this one. I guess I'll go home at 4 o'clock. Ah, sometimes math makes my brain hurt. It could do that. All right, but we're not doing math here. We're doing puzzle pieces. All right, so an infusion of normal saline is started at 2:30 in the morning. It's set to run 7 hours and 45 minutes. At what time will the infusion be complete? It really is puzzle pieces. I'm telling you, I want to show y'all something so bad, but you just gotta wait. It's yeah, just gotta wait. Uh, okay. So if we start at what time will we start at? 2:30, 5 in the morning? No, 2:30 in the morning. That was my shift. Y'all want to work night shift or day shift? I don't have it on my work computer. It's at home right now. Day shift. Day shift is busy. Night shift was my jam. I like third shift too. Alright. Being a mom and a wife, I had to go to day shift for a little bit. Then I went to night shift and I was like, nope, not going back, not going back. Can't drag me back. All right, so we're starting at 2:30 in the morning, okay? And then it says it has to go for 7 hours and 45 minutes, right? So if you add 45 to this, because this is going to be the minutes, right? And this is going to be the hours, right? Wouldn't that be like 75? So if you didn't know that there are 60 minutes in an hour and you be left with 15 minutes and had to add your hour right here, you would be lost, right? Okay. So therefore, I like to borrow time. So if I'm at 2:30 and I have 7 hours and 45 minutes to add to it, gonna take my 30 minutes and I'm gonna go to the next hour that's ahead. So I'm 30 minutes away, right? So I'm gonna add my 30 minutes here. So that is 3 o'clock. And I'm gonna take away the 30 minutes from over here. So that is 7 hours and 15 minutes. So now what I could do is, because remember, this is the minute side and this is the hour side. I can add my 7 hours and 15 minutes and I can get 10:15. So it makes it a little bit less confusing. Does that make sense? It's okay. Sometimes players do that too. Players mess up sometimes. Oh no, I didn't even see this. Okay. And thank you for the likes and the follows. I appreciate it. Y'all need me to do it again? What days do you have tutoring sessions on IVs? Um, I mix stuff up. So I normally go live on Sundays and Wednesdays at 8 p.m. Central Time. Okay. Right now everybody's doing their final exams and Christmas break. I'm working on more videos, finishing this book and getting it to you out there. Yes. Building up some more quizzes and stuff on my website and developing things. So I don't have the schedule live. So that's why I said make sure you turn on your notifications. So if I have like some time right now, it's the end of the day. I'm at my office. I turned on the computer and we studying. Okay. So and then I just try to include like a whatever in the session. I don't really have focus sessions. Would y'all like to see focus sessions? People who study with me privately, they have whatever it is that they want to go over. But for here, I just do kind of like maybe 10, 15 problems on whatever people request, and that's it. You like a mix of everything? Okay. Can we do it the same if it was 2:45? Yeah. Add 15 minutes to it, and then you would have just subtracted your minutes from the time, and then you would have still been able to then, add it so that it was to that whole hour instead of trying to add the hours and the minutes carry the one and all of that jazz. Okay. I like a mixture, but I'm down for whatever. Y'all just like, I don't care how you get there when you can, basically. Okay. What is this? Oh, this is a different type of one, but it's okay. We're gonna put together puzzle pieces, okay? All right, so y'all think you can answer this question just by looking at it? You think you can answer it, put a one in the chat. Mm, 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 mm. Okay, I see one. I need a private session because this is too fast and I'm a new okay, definitely. I can do that. I'm thinking about having a workshop like for beginning students. I don't know what to do. It's just so much. It's just so much. But I want everybody to pass and I want everybody to be victorious because this don't have to be the part of school that stresses you out. Okay? Stay there for med surge and OB maternal or whatever. I'm sorry. Let me share. Okay, please, because I'm lying. All right, so let's do it. Provider orders morphine. Well, it's the end of the day. A provider orders morphine sulfate 2 milligrams IVP. Once the pharmacy has sent a vial of morphine sulfate 1 milligram per milliliter, the recommended dose increment is to be administered by 2 milligrams per 3 minutes. How many seconds per increment would you administer the ordered dose of medication? That would be great for a class for beginners. Yeah. Okay. The pharmacy has sent a vial of morphine sulfate. Recommended dose increment is 2 milligrams per 3 minutes. So we're looking for seconds, all right? So we're needing to give mm, 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 converting the minutes to seconds, okay? So we're looking for seconds, right? So we got 2 milligrams per 3 minute. I think this one was sent to me by a student before. I changed it up. Okay, well, we might could do something, y'all. We have not because we asked that, right? So we wanted to give it over. We have what's ordered is what 2 milligrams, right? So if we're given 2 milligrams, that's what's ordered, and we have to give it over 3 minutes. We need to know seconds. So how many seconds is in a minute? 60 seconds is in 1 minute. So you see conversions once again, and then we have 3 minutes per 2 milligrams. Okay, your minutes crosses out. And then we have 2 milligrams that's ordered is by itself. So the milligrams cross out. So it'd be 60 times 3 times 2. So it'll be 360 seconds. And then this is just fluff because did the goal ask for milliliters per second or anything like that? Mm-mm. So if the goal is not asking for it, you're not going to use it. This is going to be your very best friend. So, what the goal is. So, remember how I said we were doing puzzles, right? So, just use your imagination with me, okay? Because we're not doing math. Math is so intimidating and it gives people headache. Thank you, Isabella, for the roses. And we're not about that, okay? So, what we're doing is solving puzzles. So, in real life, when you solve a puzzle, it comes in a box. Nope. Hold on, did I do the two on the bottom? Ah, I did. Wait a minute. I forgot about the two on the bottom. See, I told you I'll be messing up sometimes too. It's okay. So, crap. I messed it up. So, what we have, goal is seconds. All right, so we had what, 2 mgs for 3 minutes. We have 2 milligrams, and then we did 60 seconds is 1 minute. 3 minutes is 2 mgs, and then 2 milligrams at the top. So boom, 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 boom. Put it over one. That was 360 divided by two. So it'd be 180 seconds. Thank you. Thank you. All right. So, well, I was talking about puzzle boxes and pieces, okay? So, when you do a puzzle, the box has a picture on it, right? That's what the puzzle is supposed to look like. So, the goal is what we want our equation to look like once we get done setting it up. Okay. The goal is what the question is asking you to solve for. So that's what we want the equation to look like. In dimensional analysis, we don't use formulas. You use conversions. It goes from one set of conversion to another, to another, to another, canceling out your units until you get what it is that you're looking for. Okay. So, what I call puzzle pieces are your conversions or things that are relative or go together. Like they said, go together real bad in the problem. So, everything that's together or that's in a relation to each other stays together and they're on one puzzle piece. And then everything that's by itself stays by itself. Okay. And it's on one puzzle piece. So that's why I'm saying puzzle pieces. We're putting the pieces together so that they fit to make the picture, which is what the question is asking for. Okay. Bees, y'all got this. And I know if it's just me, but I didn't get any dosage on NCLEX. Oh, I know. I hardly got any as well. Okay. All right, so this is an IB question. Somebody was asking me for an IB question earlier. I don't know if you're here or not still, but hey, if you are, cool. So look, IB questions require volume over time. How much volume are you going to give to your patient? How long do you have to give it to said patient? Okay, so we want to look for volume over time. And the time is the infusion time, not the frequency. You can identify the frequency by having every in front of it. So when it says every 8 hours, every 12 hours, every 6 hours, that's how often you give a dose. This is not asking us how often do we give this IV fluid or how often we give this medicine. We need a rate, okay? So, what is our volume? Our volume is 1,000 mLs. What is our time? Our time is 8 hours. Okay. So now we can look for we have a drop set. So we got a micro drip set. There is only one micro drip set, and that's going to be 60 drops per milliliter. All the rest of them are considered macro. So micro means tiny drops. So it takes 60 little tiny drops to fall in the chamber to administer 1 milliliter of solution or medicine. When it says 10 drops per ml or 15, 20 drops per ml for your drop factor, those are big, fat, juicy drops. So it takes 10 drops just to give 1 milliliter versus six little teeny tiny drops. You usually use those for like the peds or like the little NICU patients, okay? All right. So therefore, somebody ask a question. It's in hours. So I'm not converting nothing. If you stick around here, you'll see I don't touch it. I take the information from the problem and I use my conversions and I let the math. So what I'll do is I'll say my goal is drops per minute because that's what it's asking me to find. I'll start with my drops. So 60 GTT per ml times 1,000 mLs over 8 hours. So you see my milliliters crosses out. I need minute at the bottom. I have hour at the bottom. Okay. So therefore, I can do 1 hour is 60 minutes, which is another what? A conversion. So you see how important knowing your conversions is for doing this math. And even if you use desired over half or ratio and proportions, you still got to know your conversions. Okay. So 60 times 1,000 divided by 80. No, sorry, 8 divided by 60. I was looking at 60 and 8. Okay. So to be 125 drops per minute. 60 drops, yeah. So that's a micro drip set. So you see, whenever you see it says micro drip set, there is only one micro drip set, and that's 60 drops. Oh, thank you for joining the team. That's only 60 drops per milliliter. Macro. So remember, macro is big, micro is little. So if you have like 15 drops per milliliter or 10 drops per ml or 20, whatever, they can throw out some crazy numbers if they wanted to, but these are all, well, these are all macros. This is the only micro. Yay, look at you. Almond joy. You had so good you had to say it twice, right? I get it. I just need to learn conversions because I'm like, where are you getting these from? Exactly. So if you're starting or you're in the program and you just kind of made it through, get strong on those conversions. That's the first thing. Just like you got to go to fundamentals and health assessment to be successful in the rest of the program, you got to know your conversions. And then those calculations didn't go away in our program. We had at least about 5 or 6 questions on every test. So yeah. Mm, mm, mm. I am looking forward to my nursing journey. I'm excited for you, Miss Brindle. Yes, you need to know conversions. That's the basis. Yep. What's macro drip? Okay, so y'all want to make me do this, don't you? It's okay. I'm gonna do it, but y'all gotta promise not to laugh at me because I am a dosage count tutor slash boss. No, I'm not an artist, okay? But so you have like the IV bag, right? And then you have it's got the little tubing, and then it's got this little drip chamber right here, and then it's got the rest of the tubing that goes to the patient. Uh, okay, so this is the drip chamber. And this IV bag, when it's not on a pump, it's via gravity. That means gravity is gonna pull that medicine down, right? So you have so many drops that will fall in this container, in this drip chamber, and that is your drop fat. Kevin, Kevin, I wish I could boo. Hold on, let me see. Wait a minute. Mm-mm. Dang, it wasn't a boo. It was a boing. God dog. Exactly. That I wowed you. So I put Look, okay, that's the little measurements on the side, okay? Golly, I told you I don't talk about me. But anywho, so that's what a drop factor is. How many drops in this container does it take to fall in there to administer 1 milliliter of fluid? Okay. So when it said micro drip set, it had to have 60 little small drops. So it has to have 60 drops. And they're little teeny tiny drops because every administration set or the tubing is calibrated differently with the hole so that it could be either big fat juicy drops like a macro drip set or micro, which is the 60, is the little small drops. Because think about it, if you have 10 drops, which are big, it takes less, you know, drops for it to administer 1 milliliter versus a micro drip set when you have to have teeny, 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 tiny drops. Okay. So that's all a drop factor is. Did you know what a drop factor was until now? It's okay if you didn't. Man, we're supposed to be on Christmas break. Well, we breaking. I'm not break. I don't ever get break. So whatever. I just it's the end of the day. I came on because I had a minute. Yeah. And Kevin's on here. Y'all go follow my guy, Nurse Kevin. Kevin, tag yourself with your little shady butt. He is an NCLEX strategist, um, nurse mentor extraordinaire. He is awesome, y'all. He'll help you get through those questions, learning how to break them down, what to look for, how to answer it. Because if you see, it's not just enough to know the question or the content in school. It's about how you answer. Yeah, how you answer. Y'all want to do another one? Uh, I'll be spending my break learning this. Yeah. So I don't have scheduled time. So make sure that you're following me here and on YouTube because I'm on YouTube now, right now. Um, and the schedule lives will be back at the end of the month. Okay. So yeah, my YouTube name is ABlessedRN. I'm on Facebook too. Are y'all on Facebook? What are we gonna do when TikTok goes away? I don't like this because I don't like this. I feel like my best friends is leaving me, you know? I don't know. Anywho. Ah, and my instructor said we're never on break. No, you're not. But you have to make some time to fill your cup up because you can't pour out of an empty cup. Okay. I struggle in human anatomy, and I will take that class in January. Khan Academy might be a good resource for you. KAHN, Khan Academy on YouTube. It's Tuesday. This isn't gonna mess up our Wednesday tutor. Raquel. So I'm on break. I'm on break. I might be on tomorrow afternoon if I get a minute. Might not. So I won't be on at 8 p.m. because like I said, I'm trying to get this workbook finished. It's in out and presented in your hands or on your iPad so that you can have me in book form. Okay. All right. I got 100 on my dosage calculator because of your method. I truly appreciate it. Hey, CC, get it, girl. All right. I think, oh, wait a minute. I think someone's gonna stop the band. You do? I don't know. I don't know what's gonna happen. Amen to that. 50 drops per minute. Oh, somebody already started the question. Okay, let's do it. Let's do it. All right. Thank y'all for studying with me this afternoon. Let's do it. The provider orders 1,000 mLs of D5W to infuse over 5 hours. The drop factor of the administration set is 15 drops per milliliter. Calculate the number of drops per minute in the to infuse the solution. So our goal is what? Drops per minute. That's the picture on the puzzle box. So we want to get drops on the top and minutes on the bottom, okay? And yeah, thank you for oh, we're at 5.7K likes. Look at y'all. Y'all are generous today. I can't get over this cold, y'all. About 2 weeks ago, I had flu A, and now I got this cold. I mean, life is life, but we still studying now, okay? So 1,000 mLs is the volume, right? Because we're doing volume over time. And then we have 5 hours, okay? And then our infusion set is 15 drops per ml. So if we're looking for drops, we start with drops, okay? Because we want this on the top and this on the bottom. So what we start with what you're looking for. That's what I mean when I say start with what it is that you're looking for. Okay. So 15 drops per ml. Now we have milliliter on the bottom. So I put my milliliters on the top. And what's together stays together. Because remember, this is a puzzle piece. You don't cut a puzzle piece, you don't bend it, you don't break it, unless you're trying to cheat. But then your puzzle piece won't, I mean, your whole puzzle won't look right, right? All right. So milliliters cross out. If you're not writing your units of measure by your numbers, then you're doing yourself a great disservice because that's what a sauce is. That's how you know what comes next. That's how you know what to cross out and what to keep. Hold on, y'all. Hey, what's up? Yeah, I'm on a session doing tutoring. Okay. I don't have any spray. You need some wipes? I'll put some spray in here tomorrow. I got some at home. Huh? Login sheets? Okay. No, you're fine. I guess yeah, I'm up here doing the study session. I made some more. Well, this is no, you can get these. Thank you. All right. Have a good evening. You too. Oh, we still here? Okay, y'all waiting on me to finish this, right? Okay, okay, okay. What we doing? Okay, I got hours at the bottom. I need minutes, right? So I'll do 1 hour, 60 minutes. Hour crosses out, and now I have drops on the top and minutes on the bottom.